Hi, I'm Dr. Adam Baus. Today, I'm going to tell you more about how you can participate in the Electronic Patient Health Questionnaire 2 project, or ePHQ2. As you know from your work in primary care, the ePHQ2 is a tool used to screen for depression. You may not know that the ePHQ2 is an extremely sensitive tool, meaning, if we screen 100 patients that have depression, we will only miss 3 just using 2 simple questions. Our group, the West Virginia Alliance for Creative Health Solutions, has decided to study the ePHQ2 more closely. In our communities, we often know our patients outside of the office. A patient may coach your daughter in baseball or be your son's teacher. You may go to the same church or even be neighbors. We wonder if this impacts the screening results. Will people be honest with you if they know you personally? To study this, we'll compare 2 groups of patients. The first set of patients will have a scripted, face-to-face depression screening with you. And the second will do the screening on an iPad. We'll talk more about this in a moment. Patients who may participate in this study are those who are age 18 and older, who understand English, and who do not carry a diagnosis of depression. It may be best to have an advanced list of eligible patients scheduled for the day. When you're rooming eligible patients, please ask them if they'd like to participate in a study regarding depression screening. You may wish to say something like this: "Our office is participating in a study about a screening tool for depression. Would you like to take part?" If they say no, carry on as usual. If they say yes, you'll hand them an iPad. The iPad will have a program already installed. You or the patient can press play, and there will be a brief introductory video. We'll ask for their consent to participate. We'll ask for some basic information: their age, gender, race, and who their insurer is. In the first group, the ePHQ2 will be administered by you in a face-to-face format. Patients in that group will complete the demographic questions and then hand you the iPad. Next, you'll administer the ePHQ2. It will be very important for you to follow the script word for word. You'll input their answers on the iPad and press a button to securely save their responses. You may also enter their answers into your electronic health record as usual. In the second group, we'll use iPads to complete the ePHQ2. After the patient watches the introductory video and enters demographic information, the ePHQ2 will be administered. The questions will be presented both on the screen and by soundtrack. The patients will complete it on the iPad and then hand the iPad back to you. You may enter the results into the electronic health record. When finished, you'll press a button to securely save their responses. No responses to the survey are saved on the iPad itself, but are instead saved securely to the cloud using Qualtrics software. So there's no risk of patients seeing each other's information. The iPads will be wiped clean of data by sending to Qualtrics, so there's no risk of patients seeing each other's data. The iPad should be locked in a secure location each night and recharged. Your site investigator will advise you when to begin collecting data in the face-to-face format and when to switch to the iPad format. We anticipate gathering data for the next 8 weeks. Thank you for participating in this research that can improve the health of West Virginians. If you have any questions or concerns, please see your site investigator. Thank you.